Good evening. I'm Dr. Kim, and tonight's health nugget is going to be on the flu vaccine. Influenza A and B are the two viruses that cause the flu epidemic that occurs each fall and winter. Each year, these viruses mutate or change its genetic makeup to make a whole new virus. And so people who have been exposed to the flu in the past don't have the same immunity against it as they did back when they had the exposure. So because of that, vaccines are created each year to protect against the flu. So far this year, influenza A has dominated. The CDC estimates that so far this season, there have been at least 18 million cases of the flu, 190,000 hospitalizations, and 12,000 deaths from the flu. The most susceptible groups are infants, pregnant women, and immunocompromised individuals, such as patients on chemotherapy or chronic steroid use or transplant patients, just to name a few, and the elderly. So some flu signs and symptoms include fever or feeling like you're having fevers and chills, cough, sore throat, runny or stuffy nose, muscle aches or body aches, headaches, fatigue, and then sometimes people have nausea, vomiting, and diarrhea. And these symptoms sound pretty similar to COVID-19. So if you have these symptoms, we recommend that you see a healthcare provider so that you can get tested to figure out what is going on. Because if you have the flu, there's actually treatment for it. There's also treatment for COVID-19 too, but there's been a shortage, and so it's difficult to get some of those treatments, but there is treatment for the flu virus. So we would need to know whether or not you are flu positive so you can receive the treatment. Even though there is treatment available, prevention is key. And so it is recommended that everyone receives the flu vaccine. So the flu vaccine for an upcoming season is based on research from the previous season. So for example, the flu vaccine for 2022 was created looking at the data from 2021. And so that's how they try to keep up with the changes of this virus. The CDC has recommended that the flu vaccine is given universally with the goal to prevent the epidemic, reduce the amount of hospitalizations, and reduce the severity of disease. So there are some myths surrounding who and who cannot receive the flu vaccine. So again, the CDC recommends that universally everyone receive the flu vaccine. There's only a few groups who are recommended against receiving the flu vaccine. And these are someone who has documented Guillain-Barré syndrome anywhere from immediately after the injection to up to 6 weeks after receiving the injection. Guillain-Barré syndrome is a temporary paralysis. And so if someone has received that after the flu vaccine, then they should not receive the flu vaccine again. The flu vaccine is not recommended for infants under 6 months of age. For people who have severe life-threatening allergies to any ingredient in the flu vaccine, such as gelatin, antibiotics, egg is not one of them. There are several variations of the flu vaccine that does not does not have egg in it. So having an egg allergy is not a contraindication to receiving the flu vaccine. And then lastly, if you've had like a severe allergic reaction to the flu vaccine, be it hives, anaphylaxis, when it feels like your throat is closing, angioedema, which is where like your lips swell really big, your lips and your tongue swell. So if anything like that happens, then you should not receive the flu vaccine. So in conclusion, the flu vaccine is a universally recommended vaccination with the goals of preventing severe life-threatening disease due to this influenza virus and hopefully reduce the amount of hospitalizations and deaths from this virus. Thank you.